Hey guys, so today me and Eugene are going to get together. We're going to talk about our BJJ Fanatics course that we put out. It's called the Mat Return, How to Get Back to Jiu-Jitsu After an Injury. For people who aren't aware, we're both physical therapists. We're both Jiu-Jitsu black belts. So we're kind of like the most knowledgeable people on getting Jiu-Jitsu athletes back. So, we're just going to talk about the course a little bit, kind of how someone can use this course to its best of your ability. We'll go from there.
Cool. So let's get into it, man. So one of the common questions I get, I'm sure you get this a lot, is about injuries, like what to do when you're injured and things like that. So let's just talk initially, just common jiu-jitsu injuries. So what are like some of the things you've experienced? I know there's some research out there as well. What are some of the injuries that you kind of see commonly in your day-to-day?
Sure. Yeah. So I think knee injuries are going to be like across the board the most common joint that's injured among all grappling sports, but judo, wrestling, but still for jiu-jitsu. Mechanisms are going to be slightly different. Obviously, for wrestling and judo, it's going to be more throw based, but jiu-jitsu, we also have a little bit more positional scrambles, or now the joint locks, heel hooks becoming much more common. Knee injuries are on the rise. So already that's going to be number one. Two, so I guess this one's kind of interesting because it changes depending how you look at it. But if you look at across the board, shoulders would be like number two. However, if you look at competition, elbow injuries are going to be a little bit more common. And the most common mechanism of injury for an elbow injury is going to be armbar, right? I mean, that's legal white belt through black belt, legal in kids, right?
For sure.
But then also obviously people like doing a posting out, having a bad break fall. By the way, I know obviously we don't know when that's going to be aired, but right now I've been watching a lot of judo judo because it's the Olympics come out, and it's hilarious because obviously judo guys know how to fall, but the rules of judo, right, where if they fall on their back and they fall correctly, they lose, so they're actually falling incorrectly. So it's just kind of interesting. Yeah, because if you actually want to fall forward, because then they don't score, which results to these bad people reaching out. So even though a judo practitioner is most likely going to be better at break falling than jiu-jitsu, we're still going to see those elbow injuries.
Yep.
Yeah. So I would say that's probably like 1, 2, and 3. And then after that, look at research, and it's starting to get a little bit more common. I see clinically where rib injuries are actually fairly common.
Yes.
And then, after that, then the injuries get a little bit funny because it goes from like a macro injury, like someone fell on my knee, versus like back or neck pain, which, I mean, you do jiu-jitsu for 10 years, your neck's going to hurt because you get people just cranking on it.
For sure.
Yeah, I would say those are like top 5, probably what we're going to see most. What about anything you want to add?
Yeah, I agree. It depends on kind of, you dive into the research, and you'll see some different stuff competition wise versus, in just drilling or practice scenario. But I would agree. I think knees are very, very common. And then you're seeing like shoulder, elbow. And then I think more of a chronic stuff that I see is chronic like just low back and neck, which is more of a chronic thing. Usually it's not like somebody injures it, like off. It's more of a repetitive kind of, like you said, years of jiu-jitsu. I've got some neck, and not really neck, but more low back stuff that I kind of commonly deal with. And I feel like, I have to really be on top of that stuff. So I would agree with those. And then, with the rule sets, that also is going to dictate, with the popularity of leg locks and things like that, you're seeing a lot of these, knee injuries. For sure. So knees are common, and that's something I see a lot of. So let's maybe talk about, we can use the knee as an example.
Sure.
What's maybe if you see somebody or somebody reaches out to you and they're like, hey, how serious is this? And obviously we can't assess them. What are some guidelines that we talk about? You and I both kind of discussed these off the air, but what are some of the things that we would look at, or you would look at initially, and I'll see if there's anything to add.
Yeah, so without going into too much detail, obviously we could talk about the presence of pain. When we say pain, obviously something's injured, it's going to hurt, right? But like resting pain. So if you're having, literally they're not moving and it's hurting and it's throbbing, obviously that's going to be a little bit more of a worrisome. But I would say the 2 biggest ones we're going to see for leg is going to be some type of instability, right? So someone falls on your leg and now it feels like your knee's loose, like that's because when something's like that, it might be something minor, where it might be like a minor MCL sprain, or it could be something severe like a complete ACL tear.
Yeah.
And the only, like, most likely you're going to need surgery. I know there's a lot of research out there with non-op ACL, but I would say, especially in the US, they're going to push surgical management. So obviously, anything that might need surgery, like, you want to go see, go through your proper medical channels, because, if, let's say, you're trying to rehab and we're not really getting anywhere, then you get the scans, they might have been said, hey, you should have just went straight to surgery.
Yeah.
Right?
Yeah.
And I guess the next big one would be like a locking or catching or mechanical, which is usually a sign of a meniscus tear, but it's not always a meniscus tear. Like me personally, I've had 2 loose bodies, so I had a bit of cartilage floating around in my knee, and that is not a rehab thing. That's they got to go in and take it out, sort of thing.
For
So,
sure.
yeah, I would say, like, some of these are going to be pretty important red flags, because I mean, we know this, but for people who are listening, jiu-jitsu athletes are notoriously stubborn, and they don't want to go see someone. They want to just rely on they want to rely on Reddit, which is like, don't do that. So, obviously our course could hopefully fill in some of the gaps, so you're not just like asking your buddy who has no idea what they're doing. You can kind of get a little bit more idea of if you fall into this into this category. So you're like, okay, these 2 physical therapists say do this. And the thing is, like, we're physical therapists, right? But, like, we're also black belts in jiu-jitsu, so we're not going to be those people to say, oh, you got to quit jiu-jitsu. Like, we're both on the mats, like, every week, right? So I've had everything, probably every joint injured in my body. So people are like, oh, you're supposed to say this. Look, I'm on the mats. I deal with injuries too. So, like, the stuff that I'm telling you is based on, good medical knowledge, but also someone who's very passionate about jiu-jitsu.
Yeah, we speak from experience too. Like, I mean, like, we've been there, we've kind of dealt with some of these serious injuries, and we've seen them, on the mats. I've been, on the mats with a training partner, maybe somewhere gets injured. So I think, like you had mentioned, catching, locking in the knee. The other thing is, if you can't put weight through your leg, like, if you can't really, I mean, obviously initially it might be kind of uncomfortable, but if it's like the next day and you're like, hey, I want to, and you're still not able to take a few steps and put weight on the leg, it's probably a good idea to just get it looked at. Worst case scenario, there's nothing, or best case scenario, you go in, there's nothing going on. That, and then, like, pain levels, we talked about any kind of, pain. If you use a scale of 0 to 10, well, I like to go by, if it's your pain, resting pain is higher than a 4, you probably need to get that looked at. So yeah, just some ideas. But we have in our course, the mat return, we actually have a section on red flags, and those are kind of points that you need to be aware of. It, if you have any of those red flags, it's a really good idea. It's really recommended that you go get it looked at by a medical professional. So that's something the course can direct you into specifically, just so you have that guidance. And like, hey, if I've got some of these things going on, probably not the best idea for me to kind of keep training.
Yeah, absolutely. I totally agree.